And speaking of the role of the capital sales force, firstly, it's a demanding job. These folks have to be skilled at talking to surgeons about the potential benefits of robotics, and then communicating that skill upward in the hospital to the CEO, the CFO, perhaps the CMO, the Chief Medical Officer. And it takes a rare person that can traverse both the clinical and then the more transactional side of the conversation with the executives. It's also changed a lot over time. When few hospitals had Da Vinci, it was really about selling on vision. You don't have this as something that could benefit your patients, you need to acquire it. Well, if you don't have something you think there's need, that can go pretty quickly. Now, many hospitals have it, and the landscape has changed. With ACA and other economic realities of hospitals, they are more pragmatic buyers. And so these salespeople have not only have to talk about selling on the vision, but they have to talk about the real benefits to a specific hospital in a specific market and how the dollars and cents work for them, need to work for them. And to be honest, we have an obligation there. If the technology doesn't work financially as well as clinically, then we're not really helping our customers get better and be more successful. But it takes a rare salesperson to be able to traverse that broad landscape. So we think about the decision maker to do robotic surgery or not. At the end of the day, it comes down to surgeons, and typically more surgeons than one. So what I mean by that is the real people that can decide best for the hospital are the surgeons that are doing it one way, and they see the robot and they decide for themselves that this can help my patients. They're the most important. And typically you start with the one, and then you grow from there. And that collection of surgeons should work in concert with our sales force to communicate upwards in the organization, CFO, CMO, CEO, the benefit of robotic surgery. But at the end of the day, in terms of starting a new program, someone signs a check, right? Someone has to acquire the technology. That's where our capital sales force is really skilled at understanding, okay, even if the CEO says they want it, who do they need to ask for approval? Is it the board of directors? Is there a regional ownership of the hospital? And there's process behind every acquisition that our folks need to understand and help navigate. So in terms of the economic value proposition of Da Vinci, the formula is actually pretty straightforward, although it's misunderstood. To have a successful economic program, it really is measured and comes down to a few things. Firstly is providing great care. If you do that, you can perhaps lower your open surgery rate, which lowers your patient's length of stay, which lowers the cost of putting them up or bed days. That's cost avoidance. That's a good thing. There are other benefits of avoiding complications, blood transfusions and reoperations that can also be avoided by robotic surgery, and that's a good thing for the hospital, cost avoidance, although it's hard to measure. The second side of that ledger, of course, is the revenue side. And if you're successful in creating a really best-in-class minimally invasive surgery program through robotics, and you let patients know about that, more patients should want to come to your hospital, and that can grow your total volume. That's good. And secondly, your mix. Patients that have the ability to seek out different types of care from different providers also tend to have the best insurance. And so robotics has also proven to show a potential increase in commercial payer mix, and that can also be beneficial on the revenue side of the ledger. Also, when you think of the economic model for hospitals, cost is important. Hospitals tend to look narrowly at the cost of the OR equipment of robotics versus the cost of what they're doing, say in open surgery, which is a scalpel and suture. That's important, but also you need to look at the cost to treat that patient from the day they step foot in the hospital to 30, 60, 90 days post. And in that case, robotics is really valuable in terms of reducing the overall cost to treat certain patients. In addition, looking just one-to-one robotics versus other modalities, say laparoscopy, the cost is actually a lot closer than hospitals think if they actually take the time to measure it. And that's something we're working with our customers to do now and help them understand their cost better and also be completely transparent on what it's costing them to use our product. And making economic arguments for Da Vinci, multiple people take that on. Certainly our sales force do a part of that, but it's complex. And it's complex for anyone, let alone a salesperson that doesn't have the training necessarily, nor the background in that area. So we do what we can with them through our senior sales leaders. But we supplement that with healthcare economists and people on staff that can have a peer-to-peer discussion with the CFO or the CMO. Those two worlds tend to overlap in healthcare economics. And we're adding heads in that area because we think it's important, particularly in this day and age.